With us today, we have Teresa Chapman, licensed master social worker and program director for McLaren Macomb Senior Behavioral Health Center. Welcome, Teresa. Thank you for joining us today.
Thank you for having me.
Teresa, you've been in behavioral health for about 25 years now. Can you tell us a little bit about your background and what brought you to this area of healthcare?
Sure. Like you said, I'm a licensed social worker here in the state of Michigan. I graduated from Wayne State with my master's in social work. I've been in behavioral health or healthcare for most of my career, 25 plus years. Most of it focused on behavioral health and behavioral health patients, and more recently the focus on geriatric behavioral health. In our society, I really feel like the people with behavioral health needs, there's a lot of stigma. They often don't seek treatment, but they're a very vulnerable group of people, and they really need professionals that are going to advocate for them. And that's really what drove me to want to take care of that population, really advocate for their needs so they get the treatment and the help that they need.
Sure. And behavioral health, it just in general, is a difficult topic for us, and especially if you're dealing with the senior population. So what would you say are some of the stigmas that are associated with mental illness in the senior population?
I think there's I think we've come some way in society in terms of recognizing mental illness as an illness, like any other illness, like diabetes or heart failure. It's an illness that needs to be treated. It's an illness in the brain. But I think, unfortunately, the stigma is that there's something wrong with that person. There's some sort of character flaw that they just can't handle things and they just can't pull it together and get themselves together and function like they should. And the reality is that we know, science tells us and shows us that the brain isn't working right. And there's a combination, of treatments that will work so that somebody can feel better.
Right. It's not always just the normal aging process.
Correct. Right. Absolutely.
Yeah. So these stigmas, what kind of harm can they cause for patients?
I think what happens when there's stigma, people are resistant to get treatment. They feel like if they seek treatment, people are going to see them as weak or that they couldn't handle it on their own. So they just don't seek treatment.
Right.
And then unfortunately, if they're not getting the treatment they need, they just sort of suffer longer. They get sicker, and it's really not the way it has to be. But they're often afraid, whether it's their family or society. Some people are afraid that, if they're working and they find out that they have mental illness, that there's ramifications and stigma that goes along with that.
So in your experience, there's a lot of hesitancy in getting help with these kind of symptoms.
Absolutely. I think what happens, not only the stigma, I think often people don't know what help is out there. They don't know how to find it, or they don't know what to expect, so they're afraid to seek help. There's a lot of, I think, misnomers about what it means to see a psychiatrist and what they're going to do to you. It's another specialist. Like you would see a kidney specialist or a heart specialist. A psychiatrist is just a specialist that deals with disorders of the brain. So I think that, often that's what we see.
In regards to that, so what are some common treatments that you see that seniors need help with?
We see a variety of different behavioral health issues. I think depression is very common, and we'll see anxiety, and it can be subtle. It can be subtle changes. You'll start to notice if your elderly loved one is depressed, where they might not be as active as they used to be, or they're isolating more, maybe not taking care of themselves, maybe not showering like they used to, maybe even not eating so much. Often we'll say they have a lot more physical complaints suddenly that's really linked to the depression or the anxiety, where they're just so revved up that they can't settle themselves down. We also see with the elderly population in particular dementias, and where it's progressed to the point where the patients or your loved ones are seeing things or believing things are happening that aren't. But to them, they really believe that, so their behaviors will start to change, and you'll see really odd behaviors. Sometimes somebody who has never been aggressive or loud suddenly becomes very aggressive and says things you would never expect them to say. And those are indicators. And sometimes there can be an abrupt, dramatic change, and that's something that
and that's got to be difficult for families too. Not to be able to recognize what is a change in the normal aging process and what actually can get some help. How prevalent do you think behavioral health services are for our senior population?
I think it's very prevalent. There's studies out there that say about 20% of our elderly 65 and older suffer some sort of a behavioral health issue. And we see it in our community. We don't have a lot of facilities like ours that are there to take care of and really specialize in the geriatric behavioral health needs.
Right.
But it's out there.
Yeah. So you brought it up. It's great. McLaren Macomb has now opened a new facility in Shelby Township.
Absolutely.
And it is dedicated to senior behavioral health. So people that are interested in our program and want to learn more about it, what kind of treatment do you offer for our patients in that facility?
Well, first of all, I want to say it's a beautiful facility. It's brand new. It was created in a way that really helps the patients heal, if that makes sense. From simple things like we encourage them to wear their regular clothing instead of a hospital gown, just to kind of help them feel better, more comfortable in their environment. We have large rooms where they can gather together, so they have that interaction, bringing them out of the room so they're socializing. We have a lot of natural light flooding into the environment, and it's also safe. It was built to be a safe environment. So I think that's something that a lot of facilities in the area just don't offer because we're brand new. In addition to that, we have a medical director who's board certified in geriatric psychiatry, and there's a whole treatment team that fall up under her that works together to make sure that we have an individualized plan of care for the patient. So we're really focused in on those specific behaviors and symptoms that we really need to address. We also include the families. I mean, mental illness is often a family disease, meaning that it impacts the person that presents, the person that we're treating, but it also impacts the family. It's hard to watch your loved one age because the aging process itself has some challenges, but then on top of that, to be suffering from a depression or a dementia, it's really difficult for the family. So we involve the families as much as we can to make sure that we get their input on things that are happening, things that they're seeing. And I really think that one of the best things that we offer is we really work well together as a team. We have daily programming where they're in groups. There's educational groups, psychotherapy groups, recreational groups. Sometimes we're playing karaoke or we're doing a puzzle, but it really helps engage the patients. So I think it's an all-around great program.
Yeah. I also think it's important for families and those out there that are considering the behavioral health center to know it's not like a hospital ward. It's not like an inpatient where you imagine just long hallways of rooms. Yes. It's really conducive to treatment and to healing.
It's a nice, warm environment, and we try to keep it that way, and really individualized to that patient and that patient's needs, which I think is great to be able to offer that. And we do have, like I said, we have the medical director, we have specialized psychiatric nurses, psychiatric social worker, we have a recreational therapist, just to kind of just take that patient all-encompassing to really treat the patient and the family to a certain extent.
Good. So it is an inpatient unit, but they are, at some point, obviously, the treatment is over. What can families and loved ones and the patients themselves expect after the treatment's been completed?
It is. Like you said, it's a short-term acute care to treat the specific mental illness. Patients are there, I would say, typically between 11 and 12 days, because we're meeting almost daily to see how they're doing. But we also have a discharge plan in place for that patient. So when that patient's ready to go, we have a plan in place, whether they're going back to perhaps a nursing facility they live in or a memory care, or maybe they're going back into their home or their child's home. We make sure that we have a plan in place. So they have follow-up with a psychiatrist and they have therapy, if that's what they need. Or if they're going back to a facility, if the facility has a clear idea of everything that occurred while they were with us, as well as our recommendation in terms of a plan. And then we're always available, if they need us in the future.
Yeah. Well, it sounds great, Teresa. Obviously you have a passion for this. You did choose the right path.
Thank you.
Well, thank you for joining us today and for all the great information you shared.
Sure. Thank you.
Learn more about the McLaren Macomb Senior Behavioral Health Facility and Program at mclaren.org/geropsych.